All right, we are now live.
Hey guys, welcome back. We're going to do another question and answer session. Sometimes we learn as much as you guys do from these, so we enjoy doing them. So send over whatever questions you have, and let's get to it.
Yeah, absolutely. So let's start off. So Abigail K would like to know, what types of hernia repairs do you do?
Well, I like to not use mesh for any of my hernia repairs. You just use your own tissue there. So there are lots of different types of hernias that we get. So there's ventral, there's umbilical, there's inguinal, there's femoral, there's a variety of different hernias. And so we fix them all actually. We also remove mesh if the mesh has been already placed in there from an earlier hernia surgery. So we'll remove that mesh and we'll fix the hernia without using any mesh. We've been successful at doing that for the last 15 years. I haven't had to use mesh yet.
Right. Healthy, wealthier. Why don't other doctors want to operate on higher BMI patients?
Yeah, that's a great question. And so there's a couple different ways to think about it. There is some data, it's old data published maybe during the 80s or so, that showed that the higher the BMI and the higher the weight, the higher the complication rate was of body contouring procedures such as tongue tuck. However, that data is not really, it doesn't really explain much because BMI is just two numbers, your height and your weight. That doesn't tell you whether you can do things safely or effectively. So we look at a lot of different things as part of the data, and then we also have really refined how we do our procedures. You can't do a regular tummy tuck on a plus size patient. You have to do a specialized form of that procedure in order to get a great result and to do so safely. So that's the main reason. There's also a secondary reason that, plus size procedures are more challenging, more work. And of course, some doctors just don't want to really put in that extra amount of energy and stress.
Right. Esteban would like to know, do you do liposuction with your tummy tucks?
Yeah, that's included. We include liposuction in all our tummy tucks because I think it makes everything look better.
Right. Caroline 101 would like to know, should you lose weight before or after getting a tummy tuck? Does it really make a difference?
Well, you should live your life the way you're planning on living your life. And then if that results in some weight loss, great. If that doesn't result in any weight loss, that's okay too. What we don't want to do is some artificial crash diet where you maybe lose weight artificially and then rebound afterwards. That doesn't help your overall result. You should just pick a lifestyle, diet, and activity-wise that you're planning on doing after surgery, and then just do that one.
Right. Lucy would like to know, she just got surgery with you. Can she shower with her drains in? If not, why? And can she use ice on her liposuction?
Yeah, so the drain stays in there for as long as the body wants it to stay in there because it's removing all that extra healing fluid. Theoretically, you can shower with the drain in place. However, as you're showering, you're not wearing your compression garment. And if you're not wearing your compression garment, you're not letting the body seal up as fast as it can, and therefore the drain stays in there a little longer. So I actually prefer to not shower until the drain is out because that's what the body really tells us. It makes us feel good to shower, but the body really needs us to have compression on all the time. So I would prefer not to shower until the drain's out for those reasons that we just discussed. I would avoid putting ice packs or heat packs because there might be some areas that are a little bit different sensation and you might actually overheat or overcool your skin. That might result in a little bit of an injury as well. Also, if you're wearing your compression, ice pack on top of the compression won't make a difference anyways because it doesn't get to your skin.
Right. Grace B would like to know, is there a such thing as calf lipo?
There is, and we do it. We actually do liposuction everywhere from the foot all the way up to everywhere. So obviously circumferentially all the way to the buttock area. We've also liposuction the buttock, of course the waist, the chest, the arms, the neck, all that could be liposuction.
Right. Love Jayla would like to know, do you remove the entirety of the areola during breast lifts?
So when you do a breast lift, traditionally, if you are, unless you're specifically wanting to detach the areola, usually you don't detach the areola. So you leave the areola, and of course the nipples in the center, you leave that whole structure connected to the breast gland. So it's always connected to the blood supply and then the nerve supply. And you just shift the skin on top of the gland. That's why you should not lose sensation to the nipple areola complex.
Right. Miss Lily would like to know, are you able to do Lipo360 and a BBL together?
Yeah, we do it all the time. In fact, that's actually my preferred way of doing it. I think liposuction in the waist all the way around, liposuction 360 of the waist, is the best way to really contour the waist. And then, of course, you can use that fat to add fat to the buttock area, to the hips.
All right. Claudette would like to know, can you do facial procedures and body procedures together?
You can. Obviously, the simple ones are rhinoplasty, breast augmentation, but you can certainly do a facelift, neck lift, and then some kind of body procedure. Obviously, the key is to make sure you're not making things challenging for recovery, and then, of course, the time in the operating room. So if we're doing a facelift and neck lift, I take at least 5 or 6 hours to do a facelift and neck lift, at least the way I do it. So then you have to think that maybe we only have 3-4 hours left in the operating room to do something else. So just work with your surgeon, discuss it, make sure it's the right balance.
Great. Avery H. would like to know, how long have you been practicing surgery? Have you only ever done plastic?
Yep, I've only ever done plastic surgery. So I graduated plastic surgery residency in 2007, and then I did a 1-year fellowship. I did 2 6-month fellowships, and then I immediately came to Scottsdale, Arizona. I set up practice, and so that's been 15 years now of just doing plastic surgery only.
All right, Christia would like to know, can you get pregnant after a tummy tuck and liposuction?
Having a tummy tuck does not impact your ability to get pregnant and have a successful pregnancy, so it's not a problem. Obviously, if you get pregnant, especially if you gain some weight during a pregnancy, some of your tummy tuck results may be changed. You can always revise the tummy tuck later on.
All right, Paul would like to know, what is gynecomastia?
Well, gynecomastia is basically enlargement of the chest area of a guy. So that could be a little bit of connective tissue underneath the areola, so the areola is a little puffy, or it could be the whole chest could be maybe extra fattiness or extra gland. It could be drooping, the areola could be big. It could be any variation of that. So it could be a little bit or it can be quite big. So therefore, gynecomastia surgery can be very, very low. You can do just liposuction, you can excise some tissue, or you can do a lot of chest work.
All right, Maria L. would like to know, how long do implants last?
Well, they're lifetime warranty products from the manufacturer. So theoretically, they last a lifetime. However, on average, people get them changed out every 10, 11 years or something like that. That's just a ballpark national average. But if you like how they look, you like how they feel, you don't have to change them out.
Right. Missy MJ would like to know, how long do you need to stay in Arizona after a 360 body makeover? Do you stay at the clinic?
Well, it depends on what a 360 body makeover is. For example, if you get a 360 liposuction of the waist, I would say just stay here for a week. If you're getting a tummy tuck and then let's say a broad line back lift, so basically you're removing skin and you're doing liposuction to the front and back of your waist, I would say 2 weeks for that. We do have an overnight area. You can stay there some of the time. Most of our patients will also rent out a hotel or Airbnb/VRBO home for the remainder of that 2 weeks.
Adela P. would like to know, what does my BMI have to be at for a tummy tuck procedure?
Well, I don't have a BMI restriction. I don't have a weight restriction either. You and I will get on the phone as a virtual consult. We'll look at the photos, we'll look at your health, and we'll just decide if you're a good candidate to get a great result and to do so efficiently and safely. And if we can do that, if we can do it safely and we get a great result, the BMI is irrelevant to me.
Right. Eve would like to know, can you only make an incision above the pubic area with the tummy tuck, or does it have to be from hip to hip?
Well, the length of any incision to remove skin depends on how much skin you're removing. So imagine if you're making an incision just this small, you're not going to be able to remove this much skin, because as it comes down, the center part will be fine, but then the sides will become very bulgy and almost like what we call dog ears. All these rolls of skin on the side, which of course doesn't look great. So the length of the incision has to match how much skin you're removing.
All right, Briso Sweet would like to know, can you do a tummy tuck and arm lift on a healthy sickle cell patient?
Yeah, we've operated on sickle cell without any difficulty. We'll obviously get some clearance from some of your doctors, but it should not be a problem unless for some reason your medical history or and your specialist, maybe provide some information that maybe make that a little bit more interesting to discuss, but it shouldn't be a problem.
All right, Hannah K would like to know, can you do an arm lift on the entire length of your arm?
Yes, you're thinking of an arm lift and then also a forearm lift, and you can do so. So obviously most people have loose skin from the elbow to the armpit, and that's the most common arm lift, but if there's loose skin beyond that, you can go beyond that.
How long can patients stay in the sanctuary, and can you only stay there if you got a tummy tuck?
No, you're welcome to stay in the sanctuary regardless of the procedures that you obtain, and you can stay for as long as you want. Obviously the sanctuary is going to be a little bit more in cost than, like, for example, a hotel room or renting a house, because it comes with all the stuff that comes along with the sanctuary, the nursing and staff and all that stuff. So we're happy to provide you with the quote, and then you can certainly figure out what the balance there between the sanctuary and the hotel and things of that nature.
Ms. Miller would like to know, can you do a fat transfer to enlarge the breast?
You can. Breast fat transfer is fairly common. You can only enlarge it about a cup size. So if you want to go beyond the cup size, 2 cup size increase, things of that nature, you can still do fat transfer. You just have to have, you might have to have more than one fat grafting session. So that's the option. Now you can also combine it. You can do an implant and fat transfer if you want to get maybe a little bit of a mix of both.
Right. Annette would like to know, can you still breastfeed and pump with the breast lift and augmentation?
You should be just fine. So the implant goes underneath the gland, so the gland's not disturbed, and a breast lift works on top of the gland underneath the skin, so you should be fine.
Right. And then Supernatural Gal would like to know, are your results better if you lose as much weight as possible before?
Well, it depends on what you're trying to accomplish, and it depends on what procedures you're having. So for example, if you're getting fat transfer to the buttock area, we actually need to have some fat, so being super thin makes that a problem. And then also sometimes people that are super thin, it's hard to really get some of the contours as ideally as we want to, because there's not that much fat there to contour it, so it becomes a little bit more two-dimensional as opposed to three-dimensional. However, if you're generally maybe overweight or a higher BMI, then yes, pick a lifestyle that you're planning on doing after surgery, and then whatever weight you end up losing before surgery, then that'll be fine.
Right. Jack X would like to know, I had weight loss surgery in February of 2022. How long do I have to wait for a tummy tuck?
It varies depending on your body habit. So the answer is you can wait as long or as little as you want. If you have a lot of loose skin there and it's getting in the way of either your lifestyle, your psychological well-being, but also your physical well-being, activity-wise, all that stuff, then you can have the tummy tuck at any point. If you still have quite a bit of weight to lose, just know that some of the tightness of the tummy from the tummy tuck might become a little bit more lax. So let's say, we do a tummy tuck and then you lose another 75 pounds, then it's still going to look great, but you might have a little bit of looseness kind of creep up.
Right. Ms. Miller's following up on her question about the fat transfer to the breast. She wants to know if moving can occur.
Oh, if the fat transfer moves around, it does not. Yeah, so the tissue is, imagine like a sponge. So, it's soft, it has the ability to go through it. And the fat is a semi-solid. So once you inject it in there, it can't really travel around on its own.
Right. Willow would like to know, do you recommend lymphatic drain massages after surgery?
I don't have a requirement for a lymphatic massage. I am neither against it or for it, and the reason for that is I don't quite understand 100% what it does and when it needs to be done and for how long and by whom. So what I usually tell people is if you're just getting liposuction, then by all means feel free to have a lymphatic massage, maybe wait a week or two just to get things to heal up a little bit. Then more importantly, go to a reputable person, try it, see if it feels better. If it feels better, then that's great. If it doesn't feel good, then obviously stop it. If you're getting a procedure where there's dissection, like a tummy tuck or a bra line back lift, I would wait a little longer than that because we actually want the tissues to seal back down. So lymphatic massage, where you're manipulating the tissues, it disrupts the tissues a little bit. So I would wait maybe at least 6 to 8 weeks for it.
Right. Michaela would like to know, do you offer payment plans?
We work with 3 companies that offers payment plans. So we work with Care Credit, Alphion, and Patient 5.
Right. Jill would like to know, what do you like to do when you're not operating?
Yeah, that's a great question. It changes along the way. So I do a little bit of car racing on the track, not a ton. And then I like to work outside a lot, so this weekend I'm fixing my deck that's falling apart, so we're going to do some woodworking there. What else do I like to do? Man, I've become pretty boring. I used to have a lot more stuff. Oh, I have my private pilot's license, but I haven't flown for a couple of years, but I'm going to start doing that more recently. I used to ride motorcycles a lot, but I think I'm getting to the point where I can see myself potentially crashing, so I'm only doing that on the track. What else do I do? Yeah, that's it. I like to work around the house a lot now. So that and a little bit of car stuff.
Thank you.
Yeah.
Okay. C. Shelton would like to know, how does a tummy tuck pain and recovery time compare to the pain and recovery from a C-section?
Great question, a question that we get all the time. They're two kind of fundamentally different procedures, even though they're kind of in the same area. So you have to remember, when you do a C-section, they're just making an incision, they're not dissecting. However, they are splitting the muscles, or sometimes even cutting the muscles. Tummy tuck doesn't do that. So right there's a little bit of a difference between soft tissue pain and then, of course, the muscle pain. Of course, when you have a C-section, they take the baby out and there's no tension placed on the incision. Tummy tuck, there's tension. I think the biggest component is the liposuction. When we do liposuction, that gets sore. So I think the tummy tuck is a little bit more soreness than a C-section, but I think the energy required afterwards is more for a tummy tuck. So you're just going to feel more fatigued quicker after a tummy tuck.
Vel's Ari would like to know, are you the only doctor that performs surgeries, or do you have others there to assist you?
I'm the only doctor that performs surgery. I do have staff in the operating room that helps me with the surgery in terms of passing instruments, right? And then helping open up sterile materials. And then we have an anesthesiologist there, Dr. Link, he's excellent. We have a great surgical staff. And then we have a great overnight nursing staff, but I am the only doctor that does the surgery here.
All right, Mackenzie S. would like to know, do you lose feeling in your nipples after a breast lift? If so, for how long?
You should not. You should not lose sensation in the nipple. If you do, it's pretty rare because if you the areola should remain connected to the nerve supply. So unless something happens surgically, unintended, then the sensation should be fine.
Patty G would like to know, can I get a plus-size tummy tuck if I'm pre-diabetic and taking medicine for anxiety?
Yeah, you should be fine as long as your sugar is relatively well controlled. And what that means is, in the morning of surgery, for example, if we always test your sugar. So if your fasting glucose is elevated, we may not be able to do surgery on you. That should be pretty well controlled. Your fasting glucose should be pretty well controlled. And so your hemoglobin A1C then should be, pretty well controlled as well.
Bethany would like to know, do you correct diastasis?
Always if needed.
How long until a rhinoplasty fully heals?
Well, with all healing isn't a switch. So it's not like not healed and then healed. It just slowly happens. I would say that first week you're very swollen, maybe even a little bit of bruising in the under eye area, especially if we break the bones. So that first week is definitely lots of swelling, lots of bruising. That second week you can go out in the public and probably no one really notice you had anything done. Maybe still some puffiness here, but the nose is still swollen. And then about 3-4 months, I would say maybe half or 75% of the swelling is gone. About a year, maybe 95% of the swelling.
Vic 2 would like to know, what happens if an infection appears and I have already traveled back home?
Well, the good news is that we haven't had very many infections. We do things cleanly and sterilely, and we treat the tissue gingerly so that we don't traumatize it. However, if there is an infection, we can always call them antibiotics, or you can go to urgent care and they can give you antibiotics for that. The bigger question is why is there an infection, right? So if you're here for a week or two and don't have an infection here, you shouldn't really get an infection afterwards. So sometimes you can get a little bit of infection from the drain if it gets manipulated and bacteria gets introduced. A course of antibiotics at that point should take care of that.
Right. Anna A would like to know, what is the highest BMI you have worked on?
I believe it's 54. It might be a little higher. We haven't calculated all my BMIs over the last maybe a couple of months. I don't have a good memory of them, but I know that we've done at least mid-50s.
Cheshire Cat would like to know, do you recommend doing a plus-size tummy tuck, bra line back lift, arm lift, and thigh lift at once, or would you split it up?
You can do it all at once. It all depends on how big you are, how tall you are, how heavy you are, because I'll have to do liposuction to contour everything. If you're fairly thin and if you're fairly short, we can do all that. If you're taller or bigger, it might take a good 10-12 hours in surgery, then we might want to split it up.
Right. Revlin would like to know, is there a procedure you perform the most of?
We do a lot of plus-size tummy tucks now. Yeah, there's a lot of women out there that need our help, and we're kind of the go-to place for that. So we do a lot of plus-size tummy tucks.
Great. Lucy would like to know, how long is the plus-size tummy tuck procedure?
It varies depending on how much work that we need to do, but it's a plus-size tummy tuck, which means obviously a tummy tuck with lots of liposuction with modified techniques for a patient with a higher BMI. We're going to be in there for at least 3.5 hours. It might be 4.5, it might even be 5, so in that range.
Right. Jen would like to know, do you offer mini tummy tucks? What's the difference between that and a normal one?
Yeah, absolutely. I actually wrote a book called Atlas of Abdominoplasty. I co-wrote it with a gentleman by the name of Joseph Hunstead, who has since retired. In that, we actually write a chapter on basically every single tummy tuck that can exist, including the mini tummy tuck. A mini tummy tuck is only designed to remove loose skin near your pubic area. So if you have any loose skin at the belly button or above, you should really consider getting a full tummy tuck or something different. A mini tummy tuck is designed to fix the area around the pubic area. And because of that, there's not a lot of people that are actually good mini tummy tuck candidates. But because of that as well, there's a lot of people that are getting mini tummy tucks and they usually get substandard results. So be careful about that. The idea, sometimes you'll feel like they can get a smaller incision, quicker recovery, and somehow just as good a result, and it usually does not end up that way. So I do offer mini tummy tucks for the right people.
Right. Rachel Stark would like to know, do I need to go under general anesthesia for dog ear correction? No,
you can do that under local anesthesia, unless they're very large dog ears or there's a lot of liposuction involved. But if they're relatively small dog ears, you can do it under local anesthesia if you'd like.
Right. Eduardo would like to know, can you get liposuction if you have loose skin, or will it only make it worse?
Well, when you do liposuction, you remove fat, and so that debulks the area. And so if part of your problem is too much volume, too much bulk, you can still get liposuction as long as you understand that the loose skin, for the most part, won't change. And if you're okay with that, you can totally do it.
Great. Steph would like to know, do you offer butt implants? If not, why?
I haven't done silicone buttock implants for many years now, mainly because of the fat transfer. It's a better product, it's safer, it's more diverse in what it can do. You can shape it, go into the hips, go into the buttock area. The implants are a little bit more just for projection. It's a little harder to make the buttock implants do a lot of different things. Plus, like all breast implants, buttock implants have a little bit of a shelf life in terms of them shifting around and things of that nature. So I haven't really done a silicone buttock implant for many years now.
Right. Sarah F. would like to know, why don't you do drainless tummy tucks?
We do drainless tummy tucks. I just don't prefer them, and when I usually explain to the patients what happens with and without drains, most patients opt for the drain. So a drainless tummy tuck and how we do our tummy tucks is one and the same. I just end up putting a drain in there anyways. And the reason for that is still a lot of fluid ends up coming out. That fluid would otherwise form scar tissue, and it also slow down the recovery. So for the first couple of weeks, you're not really going out to like a black tie ball gown affair, so might as well have a drain in there.
Right. Deborah would like to know, can you do a neck lift without doing a facelift, or do you need to just do both?
You can. It all depends on the vector of the pulling, right? So our neck skin and our neck muscle, called the platysma, actually goes over our jawline and into the cheek area here. So a neck lift only takes care of this part, and so the jowling will remain. And so the jowling requires a facelift because sometimes you have to pull in a different direction. So you can technically just do the neck part if you're only wanting correction in this area. Excuse me, I'm going to Sorry, thank you.
Twyla would like to know, how long do I need to stay in Arizona after a thigh lift?
A week is okay, 2 is probably a little better, and it also depends on what kind of thigh lift. If we're doing a lot of lipo for your thighs at the same time, then 2 weeks would be better, because moving in and out of cars, moving in and out of airplanes, not great.
When operating, do you ever come across unforeseen challenges, and how do you handle them?
Yeah, I think that's just almost like life, right? So if you avoid unforeseen challenges, first of all, it's impossible to avoid, but if you're trying to minimize the exposure to challenging cases, you're really not going to learn as much. So we do a lot of complicated cases, a lot of revisions of other doctors' works. We do a lot of challenging cases that other people don't do. And because of that, you already know you're going to see unforeseen things because you can't imagine 100% of everything that's in there. But you always go back to the basics, right? So there's anatomy, physiology, physics, geometry. And then so as long as you respect those things, you can get out of situations that are unplanned or unforeseen, and you can continue to get great results and then safely.
Right. Mona would like to know, is the recovery process for a plus-size tummy tuck different for a diabetic?
It can be. It can be. We just recently did a tummy tuck on a gal who is an insulin-dependent diabetic, and she reported more swelling. And then she had one of those continuous monitors and continuous pumps, and she also reported that her body really needed a lot more insulin. So I think physiologically there might be more of a swelling response if you're insulin-dependent. Maybe.
Right. Stacy06 would like to know, do you offer mommy makeover packages? If so, what is included?
So a mommy makeover is a procedure that most women and plastic surgeons will refer to when you're doing something with the breast or the tummy that's associated for someone that has had babies. Mommy makeover. But nothing really specifically defines it. So it could be just a tummy tuck by itself, or it could be a tummy tuck and breast surgery of some kind, or it could be buttock area. So nothing really exists. So therefore, because nothing truly defines what a mommy makeover is, there's no specific package per se. Just define what bothers you, and then we go through it and we identify the ideal procedure for each of those areas.
Miss Victoria would like to know, how does scarring usually look after 1 year? Is it still pretty visible?
It depends on what was done during surgery. So good scarring results in treating the tissue gently, so you're not crushing it. You're putting some tension, but not untoward attention. You're not putting too much tension on the incision. You're using the right sutures in the right depth and the right amount to heal that area, but not create too much inflammation. So that's all the stuff that's important for good scars. At a year, most scars are pretty well camouflaged.
Lauren Glam would like to know, how do you prevent blood clotting?
Well, there's a lot of different things that we do for instruction before surgery. There's a lot of different things that we do during surgery, and then there's a lot of different things that we do after surgery. It's a pretty in-depth process. We also use some blood-thinning medications, but I believe it's all the things that we do that reduces blood clots. We've had 5 blood clotting events in 15 years, no deaths. Those 5 blood clotting patients happen at 4 to 6 weeks out, which just goes to show that they started not doing some of the things that we instructed them to do because they started feeling like, well, maybe I'm recovered now, or maybe I'm healed. So it's important to continue to do all the things that we put into place for at least 2 or 3 months.
Right. Eve would like to know, is Lipo360 what gives off the snatched look?
It can be. If the skin's in good contour, if the muscles are in good contour, if there's just excess fat, then yes, you can do Liposuction 360. For some patients that have loose skin, then you have to do skin removal in both the front and the back for that snatched look. Usually tummy tuck for the front, usually a bra line back lift for the back. And while you're doing a tummy tuck, if the muscles are loose, those should be repaired too. Some of our really snatched appearing patients that you've seen in our before and after photos on Instagram usually are a combination of all that stuff: skin removal, muscle repair, liposuction.
Right. Brooke would like to know, what is the average of plus-size tummy tucks you've done in your career?
The average number of plus size, we do probably 2 or 3 a week, times maybe, let's say 50, that's 150, but I usually take a couple more weeks off a year. So let's say 125 plus size tummy tucks per year, at least for the last 3-4 years. We've been doing them non-stop like that. So that's 600 right there. Then maybe add another 400 to 500 before that. So about over 1,000.
Kim would like to know, how long after a breast lift do you have to wait to work out?
There's different kinds of breast lifts, but I would wait to work out at least 4 weeks, maybe even 6, but at least 4 weeks.
Alana would like to know, can you change the shape of your belly button during a tummy tuck?
You can, and you should. So obviously, as you gain weight and there's loose skin, the belly button becomes maybe horizontal or big and round or deep or things of that nature. And so you should change the length of the stalk, the aperture of the belly button, and then the aperture that the belly button is coming through and how the fat flows into it. You should change all that.
She is Aria would like to know, how long would you recommend to wait after getting a tummy tuck to get pregnant?
Well, if you're planning on getting pregnant, then maybe get pregnant first and then have a tummy tuck. If you don't know when you're going to get pregnant, then you obviously don't know. Obviously, you don't want to get pregnant right after a tummy tuck. That's asking a lot of your body. So if you don't know exactly when you're going to get pregnant, it doesn't matter. So just have your tummy tuck, and if it's a year later, 2 years later, it doesn't make any difference.
All right, Danita would like to know, what is the recovery timeline for a BBL and tummy tuck?
Well, the tummy tuck's a bigger part of that surgery. So the recovery for a tummy tuck is the first 2 weeks, bare minimum, focus 100% on your recovery. The second 2 weeks, more of the same if you can swing it. If not, then only do what's 100% necessary. Like, let's say you 100% have to go back to work. And then no working out for 6 to 8 weeks.
All right. Carson would like to know, do you do revision work on other doctors' work?
We do. That's how I really built my practice, actually. We took cases on that nobody else wanted to, or people thought there was nothing wrong there. So a lot of the skills that we've really generated over the last 15 years have been because we really try to help everyone. And so part of that everyone is people who've had really bad complications elsewhere. So we go in there and we try to get the best result possible. So yes, we do actually quite a bit of revision work.
All right, Mona would like to know, how long after a gastric sleeve surgery can you get a plus-size tummy tuck?
It doesn't make any difference to the tummy tuck or to you or to me. I would get a plus-size tummy tuck when you feel like, ideally when your weight is plateaued, weight loss has plateaued, or when you feel like, hey, I may not have plateaued yet, but this will make a huge impact into my psychological well-being and my physical well-being because of physical limitations and stuff.
All right, and then finally, how far out are consults?
I don't know, maybe a couple of months out for consults and probably about 2 or 3 months out for surgery, maybe the medium size cases, and then the bigger cases maybe a little bit further out than that.
All right. How do you go about setting up a consultation?
Well, so that's goes in part with the previous questions on how far out we're booked. I might be wrong about those numbers. So just call us at 855-377-3782 or hit the consultation button on drrepta.com or just message us on Instagram or some of the other social media aspects. And then just ask the gals and they'll help you get the best information about consultations and surgery.
Perfect. Well, thank you so much, Dr. Repta.
Thanks, guys. Appreciate it.